Good morning. Welcome back to Good Samaritan Facebook Live. My name is Dr. Scott Stine. I'm a family physician and Chief Medical Officer here at Good Samaritan Physician Network. With me, as always, Adam Thacker, who will be updating us on current numbers. We'll be looking over the course of the past month or two, giving you current statistics, also looking at how things are going currently with our vaccination program and where we think things are headed over the next month or two. Just to kind of lead off with current statistics, 3,663 cases since we began. But really, probably the most important numbers we talk about every week are current number of patients that are active in the community, which is around 30. And then the numbers that we look at in terms of positivity rate have come down a little bit. If we look over the course of the past few weeks, we had a little bit of a rise, now a slight decline, around 4.5% that have been the all positives and about 14.5% that have been the unique positives. So, we kind of held our breath a little bit post spring break. Numbers came up a little bit. Active number of cases came up. Obviously, the masking mandate from the governor went away, and so everybody's kind of sorting out what they want to do. But we've seen a little bit of a decline, so we hope that continues to happen over the next few weeks.
Yeah, and I think that we're going to continue to see some ebb and flow with that. There's going to be some times that pops up and goes down, back and forth. When we talk about that rate of that 14%, and it was 15-16% last week, so it's kind of moved a couple percentage points. We mentioned a few times over 10% is where we start to look at that there's a little bit higher transmission. We've got to really focus on those efforts of distancing, masking, just understanding, as events are opening back up and as activities are going on, which is a good thing, that we approach those with still having a mindset of, are we following the best public health measures that we can, so that number doesn't continue to climb and then we have to see imposed either local or state restrictions at a higher level. When you look across the state of Indiana, certainly northern Indiana is experiencing a pretty significant uptick in cases and a gradual incline in positivity rate, number of cases. We talked about it last week as you look at Michigan and now northern Indiana. So there's some anticipation that over the next few weeks we're going to see some increase in cases, and that puts the attention back on if you're feeling sick, getting tested. If you haven't been vaccinated and you're over the age of 16, you're eligible. Get vaccinated. And then those public health measures as well. All of that really is what's going to tie into having a full summer of being able to do the things that everybody wants to do and enjoying the outdoors as much as possible and getting back to some normalcy with events and activities.
And really, one of the things also to keep in mind, as Adam said, although we've seen that rise over the course of the past few weeks, we've seen more individuals that have been coming in as new cases, the number of really sick individuals has not followed that rise, which is very important. And we believe for a number of reasons that to be the case, not the least of which is the population that is getting the illness right now is working age individuals that are in their 20s, 30s, 40s, 50s who haven't been vaccinated. And then unfortunately we see those individuals tend to spread around within that population because the percentage of individuals that have been vaccinated in the 80 plus, 70 plus, 60 plus range is fairly high. Right. And those are the individuals that we are obviously the most concerned about as far as hospital admissions and having their comorbid conditions make the likelihood of them having more severe disease to be greater. But that also puts the emphasis back on the importance of continuing with the vaccination program. So as we look through vaccine clinic, most important thing is we have plenty of availability of slots at the vaccine clinic. We have ample allocation of vaccine, and people can even come into our state. So those individuals who have had challenges outside of Indiana getting the vaccine, anybody over 16 and even individuals outside of the state of Indiana who are not residents are eligible to come in. Right. So you want to talk a little bit about where our vaccination program is here at the hospital with the Pfizer vaccine, and then also with our community health clinic, and then kind of timeline too, because we're coming up on a date when that's going to shift away from those organized clinics to other measures.
Right. Yeah, so we talk a lot about our Good Samaritan clinic. Over 22,000 vaccines, have seen that really be successful in meeting the needs of the community. Keep in mind, there's also the Knox County Health Department is vaccinating, and there over 7,000 vaccines have been delivered. When you look at Facebook or other media, and you see that there's a mobile clinic kind of popping up, whether it's the fairgrounds or this past weekend there was or yesterday on Sunday, there was a mobile clinic out at the Community United Methodist Church that was ran through Knox County Health Department. Those opportunities really we're looking at. There's availability almost 7 days a week to get vaccinated. We continue to utilize the Pfizer vaccine here at Good Samaritan. Had really good success with that. Very, very low incidence of adverse reactions, even lower than vaccines that have been around for decades. Yeah. And so we're very satisfied with that. The Knox County Health Department continues to use the Moderna vaccine, and so both Pfizer and Moderna are the 2-shot series. Obviously, last week the big news in the vaccine world was the Johnson & Johnson vaccine being halted or paused due to 6 individuals that had a pretty serious reaction, and that has been tied back to the vaccine. I think that's for those that maybe were on the fence of do I get vaccinated, do I not? That rightfully so made everybody kind of pause and take caution. But a few things just to comment on that is that when you look at the data on a large scale, which in the medical world we certainly do, 6.8 million doses administered, and 6 individuals that had very serious reactions related to a specific type of blood clotting. So the FDA, out of an abundance of caution, paused J&J. So focusing here locally, the 2 vaccines that we are using are made through a different technology, different way, that there has been no linked association with that same type of clotting that J&J was linked to. And they're continuing to study that. We fully anticipate by the end of the month, J&J will probably be released back into the market from an FDA standpoint with some additional labeling that as to what to watch for the side effects that are specific to those significant reactions. But Pfizer, Moderna, the 2 mRNA technology vaccines that are used here locally, we have not seen anything related to blood clotting, and we have not seen any serious reactions, period. All of the reactions we have seen have been pretty minimal and to be expected: fatigue, headache, that type of thing, some joint pain, swelling, and really lasting 24 hours post vaccination, and then resolving back to baseline.
And the other thing to keep in mind statistically, as Adam was talking about, over 140 million doses that have been administered here as far as individuals have gotten at least 1 dosage in the United States. And the vaccine administration and issues afterwards have been very minimal. So there was pauses in the vaccination program earlier on with the other vaccines as well. And it's important to realize that we just really are cautious anytime something comes up to look to see if it's a significant reaction that's actually related to the vaccine or something that actually just occurs statistically in the normal population. And when we look at what those statistics have been, it's been very, very small. The other thing to keep in mind as we kind of move forward is people ask questions frequently about how effective is the vaccine versus new variants. We have seen that the vaccines continue to be protective. And on individuals who have actually contracted the illness, despite being vaccinated, they end up having more minimal symptoms. And that's certainly what we expect and we hope to continue to be the case as the virus evolves, as we see more mutations and genetic variations, that it continues to be protective, maybe not preventive of catching the illness. But really what we hope is that, again, the population that is at greatest risk, a higher percentage of them being vaccinated, and then the individuals that are younger, we really just want to try to ramp up and continue that vaccine program.
Well, and as you mentioned previously, when we have seen hospitalizations in these last few weeks, it's been that younger population, really a 30 to 50 years of age population, which have been lower in uptake of vaccines. And we have not seen here or regionally, with the discussions that we're having with regional hospitals, we have not seen admissions of patients that have been vaccinated and have reached that 14-day post-vaccination where they're considered fully protected. So even when somebody may come in contact with the virus, has been vaccinated, test positive, have even minimal symptoms, they're very mild symptoms, whereas potentially without the vaccine could have been moderate to severe and required hospitalization. So the vaccine is doing what was expected from a protectivity standpoint not a prevention of testing positive.
Yeah. Another thing that Adam had mentioned earlier that we still want to make sure that we don't lose focus on is the importance of identifying those individuals early on. So testing, there is ample quantities of testing supplies available. Testing results are very rapid to return, and that is the pathway to make sure that if you are a candidate for getting the monoclonal antibody infusion, that you get it quickly. Over the course of the past few weeks, because we've seen an increase in cases, we have administered more of the monoclonal antibody. And as a result of that, it's important to make sure that everybody understands that this time of year, which normally we don't see a lot of viral illnesses coming around, if you think you are becoming sick with something, please get in to see your provider, get tested, and we'll talk about getting that monoclonal antibody infusion, because it's really a game changer. We have seen since the beginning of its availability late last year that early administration within the first few days that becoming available turns things around very quickly. Unfortunately, we see individuals that kind of stick it out at home and get into that 7, 10, 15-day range and then come in to be evaluated, and it really has very little impact on improving symptoms at that time. So those first few days are really kind of key for making sure that you get tested and then get treated if necessary. The school programs, you want to give a little update on where we've been with vaccination programs as far as our local schools?
Yeah, so the Pfizer vaccine is approved for ages 16 and older. So in partnering with the local schools, we have been able to go to Lincoln High School, South Knox High School, coordinating with Reve and North Knox for similar programs to be able to make that more convenient. So it doesn't change the eligibility. 16 years of age and older are eligible, but that's 16 to 18, some 19-year-old that are in high school taking the vaccine on the road, so to speak, to the high school. Also where staff, faculty are involved, they're able to get vaccinated there. Many of them have already been through our vaccine clinic based off of the age criteria that they were eligible many weeks ago. But where they haven't had the opportunity or had been hesitant and now have changed their mind, they were able to get vaccinated. And so that's a really good partnership. We've had a strong partnership with the schools throughout. And that's where we're able to say that our schools for the vast majority of the school year have been in-person learning and able to have a semblance of a pretty normal year. Whereas if you look outside of our community at other areas, interesting in another state, I was talking to a colleague. Their children went back to school last week, and we've missed more days due to snow than we have due to COVID. So something that has really been a strong partnership, health department, Good Samaritan, the schools, and has benefited our schools to a great deal as compared to other areas that I talked to.
Yeah, and as we kind of walk forward, the vaccine's still going to be available to those kids, even though we've done outreach in those places. Sure. They can still get the vaccine through our clinic here, through normal registration process. But our local vaccination clinics, the plan for that is going to be coming to an end in the future. Talk a little bit about the dates of that, and then similar to testing, rather than having the consolidated testing sites and consolidated vaccination sites, that's then going to be dispersed.
Yeah. And I'll qualify this at the beginning with there are ongoing discussions over the next couple of weeks as to what this certainly will look like based off of changing eligibility for the vaccine. So we know that Pfizer has submitted to the FDA for ages 12 to 15 to be approved. It's anticipated that that will be approved by the end of this month. So that's another population that it kind of opens up to. So we're working with the health department, and the plan is that by the end of May, we will see the mass vaccination sites at the church for the health department and here at Good Samaritan start to really go back into normal operations. So you have the health department that has an immunization clinic at the health department, and then through our primary care offices being able to administer vaccine in the offices. What will impact those decisions is the demand. If we're still seeing a high demand for vaccination, and as more FDA approvals and changes to the criteria come out, we'll have to make adjustments based off of that. But really see that, by the end of May, the goal was by May, every eligible American had the opportunity to get vaccinated. And certainly looking at our region and controlling what we can control, by the end of May, can confidently say that our region, Knox County and the surrounding counties, will have had the opportunity to come to the vaccine clinic and get vaccinated. So after that, it will be more of a dispersal into the normal healthcare flow.
Yeah, so certainly convenience-wise right now with ample vaccine, with openings at the vaccine clinic, we would encourage people, get signed up, get your vaccine now, get that box checked, and then that helps going in the future because as things change and it gets more dispersed, it'll actually probably be a little bit more challenging to get those easily scheduled appointments.
Absolutely.
So right now is an ideal time to go out and take care of that. Any other things before we head to the phones?
No, I don't believe so.
Tiffany, you have anything for us today on the phones? Mushroom hunting tips, perhaps? No?
No. The only question that was asked, you've already answered, and that was when you would expect the age to change on the requirements. So,
yeah, and just to clarify on that as well, that's purely a educated guess based off of the information that's being put out. What we know factually is that ACIP, Advisory Committee for Immunization Practices, has started to review Pfizer from that 12 to 15 population. All the data look really good, and in essence mirrored the adult data as far as side effects and that type of thing. But because we are talking about an adolescent population, they're going to take a few extra weeks. That's to be expected. So really looking towards the end of this month.
And it wasn't that population was found to be unsafe or anything of that sort. When the studies were started, they had to pick an age range.
Right.
Some picked 16 and up, some picked 18 and up, some picked older. And so the ideal situation is now that we're having the higher risk population really has a high percentage that have already been vaccinated. Now we can start whittling that down and moving into the younger population. And that will, obviously as we continue to do that and then look into the next season as we go into the fall, there'll be lots of questions and lots of studies that will be coming through telling us, is this something that needs a booster? Is this something that we need additional vaccination? But right now the push still needs to be is to get the largest percentage of our population vaccinated that we can, reach the highest herd immunity numbers that we can, shut down the number of cases that are becoming active. And then that basically gets us back to the blue state where we saw the counties in the blue. And that's really what we're hoping to look at. When Adam and I look each week to see those updates and really each day to see kind of numbers wise, that's the percentage positives we had, the number of active cases in the community. That's really what sets the pace for what we're looking at a week ahead, 2 weeks ahead in the future.
And you get the question why 12. So if 12 to 15 age population are pretty low risk as a general population, why the vaccination? And so you hit on it from the get-go. The race has been to vaccine enough to get ahead of transmission. And so while 12 to 15 getting COVID and the concern is transmitting that to another population, their parents, and then to grandparents, and those that may be unvaccinated and are at higher risk for a poor outcome, not necessarily for that individual themselves, but to decrease that transmission.
Exactly. So that it's all about the number of people that are out potentially spreading that illness. No different than chickenpox and a variety of other illnesses. Once a high enough percentage of the population is no longer spreading that illness around, we see very few cases that pop up from time to time. Anything else, Tiffany?
that's it.
All right, very good. Thank you all very much for being with us, and we'll be with you in the future with updated dates and statistics as to where we are with our community. Thank you all.